cause belly pain is constipation. And I think that the estimates of about 15% of school-aged children having constipation are possibly even an underestimate. The child who has long periods of pain, in other words, a reflux episode usually lasts for 15 minutes, a half hour. The child who has pain that lasts for hours and hours is not nearly as likely to be having acid disease. Those children have hard bowel movements. They will have infrequent bowel movements. But you will have moms who say, and the children will say, I have bowel movement every day. However, is there a lot of straining with the bowel movement? Is there a lot of pain when the child passes the bowel movement? Is there ever any blood in the stool when the child has bowel movement? Child who has had a number of urinary tract infections and no one can figure out why, I've had a large series of those who actually were constipated, and that was the reason why they had this problem.
So there is a relationship with constipation and urinary tract because it blocks the outflow?
Well, it's probably a little bit more complex, but certainly there's an element of that as well. What probably happens is that the urinary bladder can't fully empty because the pelvis is filled up. There is a lot of discomfort that takes place in conjunction with the abdominal distension, and it's a situation that I say can go on for quite a long period of time.
If you get constipation, of course we have to exclude a kid born with it, and there's a condition called Hirschsprung's. We're talking a kid who didn't have constipation the first year, who were comfortable, has it later on. What would be your approach to get that controlled?
If the child is having an element of constipation because he or she has become afraid of passing the stools, that is a special circumstance for me, because I know that I can get that child to have a regular bowel movement, soft bowel movement in the rectum. However, that child, because he or she is concerned and convinced about the discomfort, they'll be holding the stool back. So those children, and only those children for me, will get a course of medication, and it will usually be 90 days as an average. And the duration is really designed to allow that child to overcome his fear of defecation.
If there was a medicine you were going to pick out of your head quickly, what would be the one you would use most likely?
The medicine that I would use, for the most part, in those circumstances, would be called Miralax.
And that used to be a prescription item, and now it's over the counter.
Now it's become over the counter.
And a lot cheaper, too.
And a lot cheaper, as always happens. And another agent, again, that's over the counter, it comes from a plant, and that's called Seneca. So either of those, they work differently, but either of those you can employ to, in essence, assure that your child is going to have bowel movement. However, whereas many physicians will employ that as the sole means, for me it's just a matter of having the child readjust and lose their fear. The long-term solution is really going to be dietary. And the dietary features that are important, and they're important to really understand, is high fluid, high fiber. And by high fluid, I'm talking about 6 to 8 cups of liquid a day. By high fiber, I'm talking about 3 or 4 vegetables and fruits every single day. I'm talking about changing the grains to whole grains. Specifically, I have a recommendation that the child should start every single morning off with a high fiber cereal. That they should.
Is there any particular one that you would suggest?
There are many. You have to look on the side of the box when you go to the supermarket, and anyone that has 5 grams of fiber or more will be sufficient.
Is the old-fashioned oatmeal a good source?
Oatmeal is an excellent source.
Cheap?
And cheap.
And it lowers your cholesterol.
And it lowers your cholesterol. All of the high fiber foods will lower your cholesterol. So the constipation, I always tell the parents who really need extra convincing, is your body's way of telling you that something is fundamentally wrong. Not just fact that your stool is firm, but patients who have high fiber diets, there are epidemiologic studies that show there's less colon cancer, there's less atherosclerotic heart disease, and there's less gallbladder disease and cholecystectomies, all in patients who have high fiber diet. So again, the specifics would be a high fiber cereal in the morning. You want to switch the white bread to whole wheat bread, and you want to have a starch in dinner time, which is high fiber. So you want to switch a white rice to brown rice, which also has vitamins. You want to switch the white or yellow pasta to wheat pasta, corn, barley, couscous, legumes. They're all